my bachelor's degree in biochemistry, and I got into medical school in Ottawa, which is where I've sort of grown up. And then I came to Toronto to do my residency in family medicine. And in Canada, the residency program is 2 years, and I know in the States it's 3 years. Speak three different languages. In my spare time, I like singing and dancing. And I've kind of included some clinical pearls at the bottom. They're just sort of like hopefully helpful tips. So I'm going to kind of share a little bit about how I kind of ended up choosing to be a doctor. Something I think I always wanted. I was kind of a bit nervous to maybe admit it to a lot of people. I think I thought of it in my head. I knew when I was dissecting a fetal pig in grade 11 biology that was something I thought that was really cool, trying to understand how the body works. And I know I could compare myself to a lot of my like classmates, and I didn't think they looked that interested. So I think that kind of helped me decide. I knew I also wanted a career where I could help people out. I thought I wanted to be a pediatrician and see mostly kids. And I'll kind of show you or tell you guys a little bit about how I ended up becoming a family doctor. And I think it kind of is the best choice for me. I know a lot of people, whether it is anytime from really from high school all the way onwards, are confused about what they want to do with their life or what they want to be. I know a lot of people ended up finding their way. So if my advice would be to sort of like see kind of how almost like where life takes you, but also don't be afraid to take on like different opportunities to try out different things, because sometimes you never know if you will or won't like anything. So this is kind of the stuff that I did in high school. And, really, if you're thinking about going into medical school, you can really do any activity, but my advice would be to pick activities that you really like, that you're passionate about. And actually, another piece of advice would be to note down the activities you have done. Really, it could be like really anything that you've been involved in. Just because when you kind of get later on and it's been years later, you kind of forget what you did and like what dates you did them and like who your supervisor was at the time if you're doing a job or that kind of thing. So it's nice to have all that ahead of time. So I mean, I did taekwondo, piano, badminton, a lot of this more recreational than anything, but I did do a lot of these activities for many years. So I'll talk about how you can use this kind of when you're actually applying to medical school to your advantage. I worked at a language school where I worked with a lot of people who didn't speak English, and kind of like helping kids register for school and like learning how to communicate with people without being able to speak in the same language. People ask whether you have to volunteer in the hospital. It's not something you have to do, especially now with COVID. It's really difficult to get opportunities where you are. Really, anything will be helpful and be useful on your resume. Obviously, having good grades is helpful, but I don't think it's the be all end all. So, when you're trying to figure out what direction to go, I thought it was kind of interesting that a lot of people that I went to medical school with didn't necessarily do an undergrad in science, because kind of that's what I thought everyone would want to do. So you got to pick something that you love. And yeah, I actually was in biopharmaceutical sciences and I switched to biochemistry. They're kind of similar, but they're a little bit different. And to be honest, I'm really happy that I changed my major. You'll see a lot of people change their major just because, I don't know if you really understand what you're getting into when you go into university. Figuring out what you want to do for the rest of your life when you're that young without having the right exposure is really challenging, I think. I stayed at home for my undergrad. I kind of got bribed by my parents with a really old car that you can see on the right. I mean, it kind of worked out for me just because I could focus a lot on studying, and my free time. I didn't have to really worry about cooking and cleaning because I was really lucky that my parents helped me out with that kind of stuff. But obviously, for some people, going away is a really important experience, and you can definitely. Sometimes it's easier if you're away to be involved in certain activities just because you're already on residence and stuff. So I think you have to take like a lot of things into consideration, cost, etc., finances, definitely would suggest applying for scholarships and bursaries. You'd be surprised at how many there are out there, and sometimes people just don't apply to them. And so if you kind of meet the criteria, I would just try, because if no one sort of claims them, then there's a very good chance that you can. So I mean, my clinical approach is that accept the fact that you will probably make changes through your whether it is through your undergrad or later on, and it's okay kind of to accept that. The only reason I say this is because I was the type of person who just thought it made sense to just do like everything exactly by the book, and like you make a plan, but plans change and life happens, as you can see in this pandemic year. So if you're, thinking of applying to medical school, most people will have to write the MCAT. So it's like an entrance exam. Different ways and how to prepare for it. I was someone who preferred studying on their own. I know a lot of people like to do like group stuff. I know even though we can't do it maybe in person, but even remotely. Um, Kaplan Books are just, a company that teaches, sort of goes over the process of learning how to do the MCAT. My biggest advice here would be to do a lot of practice exams if this is something you want to do. It's really for any entrance exam. You can use this really advice for anything, which is the more examples you're able to see, the better you're going to be able to understand the types of questions. And then you can go back to wherever you have gaps. It's really cool now, because now you can find a lot of these sort of like practice exams and stuff on Instagram that actually teaches you a lot of this stuff, which definitely was not there when I was studying. So in terms of when people ask how long I spent to study, I did write the MCAT twice, once in between my second and third year, and then once between my third and fourth year of my undergraduate degree. So, I mean, I took about a couple of months or a summer to sort of prepare for them. I think it's a reasonable amount of time, although I was actually still doing research during that time. I think it depends. I don't really have much of a choice in terms of how long I could spend. Um, People also ask a lot about whether research is important. I don't think it's absolutely necessary, but again, like anything else, like the more things that you have that are supportive on your sort of like resume or when you're applying, obviously will help out. Even in my first year, between like after I'd finished my first year of undergrad, I ended up getting a job in working and in research in the ICU. Honestly, by fluke, I kind of wanted to take my summer off, but my dad's friend knew someone who was looking for a student. So honestly, sometimes word of mouth also is very helpful. And so sometimes if you ask around, you never know what kind of opportunities you might find. So, when you're sort of like writing like a personal statement to apply to medical school, I talk about this only because, this is again relevant for whether you apply to medical school, any other type of professional school, even if you are like having to write something for some sort of, work, and they want to know sort of like why you're interested in what you're kind of applying to. My best advice would be to use examples, and I sort of say like you're like a painter, and sort of you want to like paint a picture of kind of what you're like. If I can say that I'm like a really determined person, I'm very focused, like I'm very hardworking, and they're very generic statements, and it's hard to sort of differentiate you from someone else. So in terms of making it personal, it obviously helps. I liked storytelling. I think that kind of helps. So for example, I mentioned I worked at a language school, so I often use that example, whether it was in my statements or even in my interview. And you talk about how it taught me to be more tolerant of people from different backgrounds, and like learning to communicate in different ways. So if you kind of use the same characteristics that you're referring to, but use an example, it obviously makes it a lot more interesting to read, and people get a better picture. Did you have a hard time in personally with your health, or did you see someone else going through something difficult? How did that sort of shape your desire to sort of go into a specific field? I feel like those things help. Again, if you're asking a reference for any job really, you want to obviously ask someone who knows you well. As a tip that someone told me once was like, you ask if whether they could give you a strong letter of recommendation. And I thought that was a really nice way to word it, because I've had people approach me and ask me if I would write them a letter. And if I'd only met the person very briefly or I didn't really have any interaction with them, I've told people that I could write them a letter, but I wasn't sure like how strong I could word it. So you want to know someone who can you want someone who knows you well to be able to give the reference. So I use someone I worked with for my research, a professor in one of the classes I was in. I did well in the class, and there's only 30 people in the class, so she could really comment a lot better. So when you're again applying to interviews, again, I like to give sort of general advice, but I mean a lot of it is obviously specific for medical school as well too. I mean, it's easier said than done, but you really just want to be yourself. People who are on the other end interviewing you, they just want to know a little bit about who you are. Are you someone that they can, that's easily approachable, that you can have a easy conversation with? It's interesting that you'll meet people who are extremely smart. You can say maybe book smart, but that doesn't always necessarily translate in how well they're able to sort of communicate or interview. So I had one interview in my third year of undergrad and two before the end of my fourth year, and that's when I got in. It's again with any interview, you want to be able to know the type of interview style. So one interview was like small, almost like small mini interviews, and you would go into a room and you basically had different scenarios there. So some of them would be like tell me about yourself, like types of questions, and some of them were actually you had to like there was another person in the room, and some of them were actors, and you had to actually interact with this person, and they sort of created like mock um, situations for you. Whereas the other two interviews I had, one was just almost like one-on-one, and one of them was a panel. So obviously understanding the way the interview works, it will be important. So you know how to prepare for it. A lot of schools actually have workshops. I assume, I mean, just like this, you guys have this amazing group that allows you to learn about the medical profession and etc. But our university had workshops to allow us to sort of prepare with other people. I'll be honest, I didn't even do that, and I probably should have. So I think I was just a bit anxious and maybe a little bit more in my head. So I just didn't want to appear silly doing these interviews, which is in retrospect kind of not a great way of preparing. I did prepare a lot with friends and family, but a lot of it was actually by myself. I watched myself. So looking at yourself in the mirror is usually very helpful. How's your eye contact? Like, how do you answer the questions? If you're looking for a book, I mean, this can be way later on. They usually ask ethics questions in medical school interviews, and this book called Doing Right. It's helpful for Canadians. Although in doing this similar presentation before, it was recognized also in the States. So it's just really easy examples to try to understand how to answer those questions. One piece of advice that I've actually used, I use this in my medical school interview, which was, and I've used it multiple times. That anytime I get a question that I don't exactly know the answer to, I'll actually just say, "That's a great question. Let me just think about how to answer that." Or sometimes I don't even have to say the second part, but it gives you a couple of extra seconds to gather your thoughts, because sometimes the question catches you a little bit off guard, and it's okay to take a couple of seconds to answer the question. Sometimes those seconds seem like a really long time, but it's better to take a little bit of time to answer properly than to kind of take the question and not really know where you're going with it. So assuming you got in, yay. So, in terms of like, what is it actually like when you go into medical school? So your first and second years are mostly classes. We had a lot of problem-based learning, means we were like in small groups of like 8 to 10 people, and we would learn about different cases. Like the patient comes in with like chest pain, what do you do? In your third and fourth year is sort of where you're doing more of your clinical rotations, which means you're at the hospital a lot and you get to rotate through the different specialties. I know for me that I felt a bit dumb kind of in some ways, just because there was a lot of people who were extremely smart and I was used to being the smartest person for getting into medical school, and you realize that no, you're not really as unique as you think. But hold that thought. um, what I eventually realized was that while I was maybe not the same type of smart as some people, I did have a lot of other skill sets that I realized, some of my friends, for example, didn't have. A couple of my friends, for example, one's a surgeon. She's great at what she does, and again, super smart. But I think she wouldn't necessarily make a great family doctor, and vice versa. So while you can kind of have what they call imposter syndrome, where you wonder if you kind of deserve to be here, you realize with your journey that you eventually find your place, and you're probably best geared towards something. And sometimes it just takes time to get there. I remember in my third year, I worked with this emergency doctor, and like it was my very first time being in the emergency, and he was pretty what's the word, not he was very tough. And so without me not knowing anything, he sort of made me very reluctant to be able to answer questions well, and I just felt like I just felt dumb. That's the best way to explain it. And so I wondered after that point whether I'd even be able to like continue, and make it through the program. But luckily, it was only one experience that I had, and the rest of my rotation was great. And I, eventually worked with some people, different doctors who were, understood where my level of understanding was, as being the very first time being in the emergency department. And so, definitely puts you through a lot of interesting experiences. You're on overnight shifts, you're on call. So you definitely learn a lot during those processes. Again, my best advice, whether it is in medical school or not, would be to just have a lot of experiences, just because they kind of tell you which direction you want to go. I really wanted to be, first, I told you I wanted to be a pediatrician, and then I eventually thought I wanted to be a specialist in something. I just didn't know what it was. So I tried a bunch of electives, and I'll explain kind of how I chose family medicine, but doing electives, meaning that you shadow different doctors, was really helpful. Again, I did some research in medical school. Again, it was a bit by fluke because I had an opportunity. It obviously, again, research helps, but you have to sort of consider everything else in mind as well too. I know that a lot of people in medical school, they come in with a very like fixed idea. They really want to become a certain type of doctor. So many people change their specialty, sort of as I mentioned before. I think a lot of people come in very narrow-minded about what they want to do. My advice would be to just keep an open mind and do the opposite and just see, because you might be surprised. So, like I said, I really wanted to be a specialist, and I thought I wanted to be like a pediatrician, take care of kids. And then I realized I kind of liked, seeing people of all ages, and I didn't know if I wanted to just see kids. And then I thought I really liked, the skin and everything related to that. So I thought I almost did all my electives in that, and I changed last minute. It's funny, I don't have a bored personality, but I kind of noticed it didn't really fit into any specific specialty. And I remember going to this talk about family medicine, and I just talked about how many options you have. So it's really interesting. So you can be a family doctor and then do a bit of training in emergency medicine. So you can become an emergency doctor, although your background is in family medicine. You can become an anesthesiologist, like family medicine who has extra training in anesthesiology. That's when you're when you're doing surgery, there's the person who's giving the medications to, the anesthesia. You can be a palliative care doctor, working with people at the end of life, making sure they're comfortable. You can do surgical assist, meaning you're being an assistant to the surgeon. You can do a little bit of what I do. I do cosmetics as well. So that's procedure based. What I realize is that like there's just so many options. And I think what I really like about family medicine in general is when I see people who are in my clinic, I do a lot of preventative medicine, meaning that you try to catch things sort of before they become big issues. And I get to see people recurrently. So I think that if you go to the emergency, like I just didn't really like that setting, but if you go to the emergency and the emergency doctor will see whatever the emergency is and then you go home, and for them they never get to find out what happened to that patient, whereas like I will generally tend to follow my patients. And so it's cool is I get to kind of know them, I get to see them kind of as they grow up, if they're kids. So that I think is kind of cool. Obviously, I mean, it's not really why I chose family medicine, but obviously the residency, the training for it is a little bit shorter, so you get to go out and practice. So when I picked my residency in Toronto, I just wanted to sort of get out of where I had been living. So I did my undergrad and my medical school in Ottawa. So I'd been living at home for a really long time. I worked in a community hospital, which means it's a hospital that's not as busy as some of the major hospitals in the downtown area. I got to work a lot with the attendings or the my supervisors one-on-one, rather than having sort of, if you watch Grey's Anatomy, you'll see there's like an attending doctor, there's a fellow, there's a resident, there's medical students, there's just a whole lineup of people. I didn't get as much of that experience, which was okay with me. It meant that I got a lot of one-on-one time with the person in charge. I did a lot of procedures. We had to do a placement 2 months where we were in a rural area. So you kind of practice medicine in a really different way. I thought that, when I was young, I thought a family doctor mostly just saw cough and colds. That's where saw my family doctor for mostly. So I realized in practicing that really it's like almost very, very little of what I actually do. For us in Canada, we do licensing exams. They're called the MCCQE. I know that in the States, you guys have to do the USMLEs. So obviously just different tests that we all have to do to be able to be licensed. If you get to this point, obviously what I thought was useful was like realizing that as a doctor, you're actually you have to understand how businesses work, and no one teaches you that. So that's kind of interesting. So I would just say that if you have the ability to learn from someone, not right now, but obviously at that point, about how to run a business, I think that is really helpful. So attending life is basically when you're done all your training and now you're basically out working on your own. So how do you find a job, etc. So I was a bit lucky when I graduated. A doctor I worked with, her friend was looking for someone to take care of her practice while she was on maternity leave. So I did that for 9 months, and I needed a job for like a couple of months. And so what I did was I went online, and there's this like online database, and I found this clinic, and I was like, okay, I'll just go check it out. Very different than the way I practiced, in the sense that this clinic is in a really low socioeconomic area. And what is really kind of interesting about working in this area is the fact that a lot of people don't necessarily speak English. There's a lot of people who have a lot of mental health in this area. There's a lot of diabetes, high blood pressure. You'll teach people something, they then forget it or don't understand it. So there's a lot of education that's involved. What's interesting also in Canada is, we say that we have a free healthcare system. Not exactly true. It just means we pay higher taxes. The only good thing about, I should say the only one of the good things about the system is the fact that, if I am seeing someone who, perhaps, otherwise wouldn't have insurance or wouldn't be able to afford to pay for the visit, I don't have to necessarily worry about that because I get paid by the government. So it means even if I'm trying to order a test, again, I don't have to worry about insurance, etc., which I know is a big part, from what I understand, talking to different doctors in the States. And what's interesting too is that I have a WhatsApp group with my friends that I did my training with. And so while you think that you have to do everything on your own and like, what happens if you don't know the answer to a question, it's actually cool. We sometimes will talk about some challenging cases and like sort of like what to do. And so that's really helpful. I'll talk very briefly about this, but I mean, you're more than welcome to answer more questions or ask me more about this if you like. I work as a cosmetic injector as well too. It was more just something that I kind of fell into. I took a course on it. I ended up finding a job in that area, and I do it sort of once a week with some remote consultations. And after working there for about 4 years, they were looking for someone to be the director there. And so I was asked to sort of take on that role. So it was kind of cool. And again, not something that I necessarily was looking for, kind of found me a little bit. And this was right at the end of my training. So, like I said, you can ask me more questions if that's something you want to know more about. So this is what my week kind of looks like. This is now during COVID. I mostly do a lot of virtual consultations. I come in once a week to see people from my family medicine clinic. On Thursdays, I do in-person cosmetic injections. They've been a little bit on hold just because here in Canada, especially where I am situated, we're currently in a lockdown situation. So we're not really supposed to do anything non-essential. You'll see that reviewing labs is like almost every day. So one thing that people don't tell you about being a doctor is that there's a lot of paperwork and a lot of forms to fill out, a lot more on your, to be honest, a lot on your free time. For example, when you order a test for a patient, you talk to them and then you order a test, you're then responsible for the test. And that can be, you might get the test results sort of like at any point of the day, could be sometimes on a weekend. The nice thing about family medicine is you can really kind of do as much as little as you want because, I work at two different clinics. So if I don't want to work, I just usually just tell them I don't want to work. It's pretty easy in that sense. But obviously, if I have to cancel a day, then everyone who's booked for that day will have to be canceled. So obviously I don't do this, but if should there be an emergency or some reason I can't work, it does make it pretty easy for me to take vacation off as well too. I'm just left with a lot of work when I come back. So it's interesting doing virtual consultations because most of us had never really done this prior to the pandemic. So we can't see people, but it's really interesting. I can probably do about 80-90% of my job pretty well. I can email people requisitions. I can fax prescriptions to the pharmacy. If someone has some symptoms that sound like COVID, I send them to like a testing center or maybe the emergency if they sound really sick. I haven't really had to send that many people to the emergency. I've been pretty impressed at how much we can kind of do without necessarily having to send people to go in to get assessed. I do see people, like I say, once a week. So for example, if I do have to see someone for a specific reason, for example, like a baby who needs their normal immunizations, the nurses will do the immunization, but I'll still do the assessment. Everyone gets screened at the door. You have a lot of PPE on, and so we're obviously just trying to be very careful. And this process kind of teaches you to recognize what's kind of like normal, what's an emergency, and being able to sort of like direct people accordingly. So this is sort of like what a day would look like before COVID. So it's usually relatively busy. I book people like 3-hour chunks at a time. I usually am off lunch between 12 and 1. The reality is that I almost always end up sort of running a little bit behind. And so I almost always eat a little bit into my lunch hour. And honestly, I'm usually checking my labs at lunch hour as well too. So I guess I could check my labs at home as well too, but just to save myself time, I try to do as much as I can while I'm actually in the office. We usually have people booked every 10 to 15 minutes. It sounds kind of limited. It's easier when you know your patients, as I do. So sometimes they come in for very simple things. A renewal on a medication doesn't take me very long. Sometimes I haven't seen them for 2, 4, 6 years, something like that. They come and find me and I'm like, why haven't you seen me in this long? So obviously they may take a little bit longer time. Someone with mental health will obviously take a longer time. A lot of the stuff I see a lot of babies, a lot of pregnant women, diabetes, high blood pressure, and mental health. Those I think are the main a lot of the main types of problems I see on an everyday basis, but honestly, I will see everything from A to Z because I'm usually the first person a lot of these people see. And what's cool is that if I don't know what's going on, I can send them for a test, tell them to come back in, or if I know it's something out of my level of expertise, I've tried, as much as I can, then I basically refer. So just to show you kind of like, the types of interesting things I will see in my practice, I have a patient who's like 50 and he's diabetic and he's on insulin and he just doesn't really want to take his insulin. And, he's been to the hospital many times. He's had a couple of his fingers amputated because of how bad his sugars has been. And it's, this was a hard lesson for me to learn, which was that, you unfortunately can't fix everyone. And it's not out of not wanting to try. We've definitely tried. It's just someone who doesn't really want to, he gets referred to a specialist and doesn't show up and ends up in the hospital. So sometimes you have to kind of accept that there's certain people that you won't be able to treat. I think that was something that was hard for me. I have a patient who has something called borderline personality. So she's got a lot of mental health. But people with borderline personality tend to, feel problems more extensively and come with a lot of issues at a time. So, even though she's pretty young, she sees a lot of specialists. And, every time I talk to her, which is quite often, I'll probably talk to her at least once a month, at least, if not more. There's always a list of new problems that have happened to her. And so someone like her is really challenging to deal with. Um, one of the most interesting people I remember seeing was this 64-year-old a patient of mine who was diabetic and had a heart attack recently. And what had happened was they took a graft. So they basically took like a vein from his leg and they used it for the heart. And so he comes in maybe like 2 months after he's had this heart attack, and as is a lot of my patients, he's Jamaican, and he tells me, he's like, "Hey doc, I have like a wiggle in my leg," and I'm like, "Okay." A lot of my patients describe things very differently than you'd expect just to have the problem described. So a lot of times, like when people talk about a wiggle or something, they're usually referring to a nerve pain. So I thought he had a nerve pain. He had a band-aid on his upper leg, and I was like, okay, cool, let's check it out. And when I removed the band-aid, there was a little hole in his leg, and there was a little bug or something staring at me. And I was like, oh, interesting. I had a student that day, so she was also very intrigued. And I, put the band-aid back on for a couple seconds. I was like, oh, there's something there. And he's like, oh yeah, doc, I took like 2 to 3 of these out already. I'm like, okay. I'm freaking out because, this guy just had a heart attack. He's diabetic, which means he's got poor ability to heal. So, I grab a urine bottle and I get clean forceps. So they're like the tweezer looking things. And I basically, go back in and I see, take this little thing out and I'm like, I think it's a maggot. I don't know if I'd ever looked at a maggot that close in my life, but that's what I thought. We sent it to the lab because I put it in the urine bottle and we sent it. And yes, it came back as a maggot. And I told him that he had to come back. Actually, I told him that he had to go see a specialist because I, freaked out. You have to go see this person. And he's like, nah, man, it's okay. I'm like, okay, not the time to be cool and chill about this. He's like, the hospital's too far away, which it's not. It's about 15 minutes. And I was like, okay, why don't you come back and see me at least? And that way I can at least have a look at it. And he came back like 3 days later. And because maggots get rid of dead skin, it actually did help his problem. And so it sealed up and it was okay. But sometimes patients are less concerned than you are, and you're on the other end worried about them. Another patient of mine is just a 101-year-old healthy male, and it's kind of cool. I don't think he does this per se out in COVID anymore, but he line dances every week. And otherwise, he's pretty cool. He can't hear, so you're yelling really loud in the clinic, but other than that, so I mean, there's just a whole range of things you see. So for me, I think it's never a dull moment. The downsides, I think, of family medicine is just like I said, a lot of paperwork. I think a lot of times when people see a specialist, when they're done, they can always just say, "Go back to see your family doctor." So you kind of sometimes get thrown a lot of problems that maybe necessarily other doctors don't really want to take care of. And sometimes it's the opposite. You're a referologist. It's not a real word, but people will come in and they say, "Well, I want to see a specialist for this," or like my uncle so and so wants me, will see me for this problem, but I need a referral. And sometimes it'll be things that I can easily deal with, but people prefer to be referred. I don't get this as much in the area I work in, but when you're in a higher affluential area, I think you see a lot more of this. Um, some people may say that family doctors get paid less. I mean, I think for certain things, probably true. But obviously, if I'm going to compare a family doctor to a surgeon, it's not going to be a comparison. The surgeon's going to make more, but your route to becoming a surgeon and the process and the amount of hours and the amount of times you're on call, etc., even when you are an attending and working on your own, is obviously much higher. So I don't think that's a real good comparison anyways. You definitely see I definitely have some challenging patients, as I mentioned. And so I think it's actually kind of a bit draining to do family medicine 5 days a week, only because, especially in the area I work, I have a lot of mental health. So taking on that many people's problems is sometimes emotionally draining. But I do really love what I do, which is why I think I've been able to find a good balance between doing that and cosmetics. And if I could go back and know a couple of things, this is just even about life. I would just talk about, I wish someone would tell me to calm down. I was a very type A personality, very OCD. So I was like, I always thought things had to, like I said, work on a very specific way, and you have to have a plan. And if you end up off of your plan, like, I remember I just didn't know how to cope when things didn't go well. So, I think if someone just told me, it might not have helped, to be honest, if someone told me. I think I had to kind of go through it myself, which is realize that life is just has good times, bad times. And the process taught me a lot about myself. I think medical school taught me a lot about how to deal with difficult situations, difficult people. And I think now not a lot of things faze me or upset me because of the fact that I've been able to make it through a lot of challenging times. We as doctors tend to not be very good with money. So, it's obviously good to have someone who can maybe help you. Like I said, it's actually, I didn't know this or didn't really think about it, but when you're a doctor, you're actually self-employed and you actually have to be able to run a practice. And so you learn the medicine in medical school, but no one teaches you this part. I think being a doctor is really rewarding. It is a lot of work. Again, you can adjust the hours if you kind of want to. So for some specialties, you don't have as much of that ability to do so. I mean, if you're a surgeon, you're really relying on being employed by a hospital. So you have to, work sometimes along the schedule that's provided for you. I would definitely recommend doing things outside of medicine because I think that's what keeps you sane, and you want to sort of keep your own personality there, right? And, having the right supports and friends and family is really important. And I think that if you can try to live life to its fullest, and then just practice being kind to yourself as well, I think that's really important. I don't know if I was always as kind to myself, and so I think I learned that more with time. So just as a summary, I mean, I did 4 years of undergrad, 4 years of medical school, 2 years of residency. So that's like 10 years, right? And I remember when I first went into medical school, no, when I first went into my undergrad, like I said, I was really, anxious and I used to overthink things. And I realized that if I was going to stay this worked up about everything, I would never make it through 10 years. So I kind of taught myself a little bit to balance things out a little bit, but I wouldn't change anything. I think everything kind of helped me become the person that I am today and become the doctor I am today. So that's pretty much it. I think I've gave it about 40 minutes or so. You guys are more than welcome to contact me on either through email, and that's my Instagram handle, hey Dr. Sarah, but either one is totally fine. I did want to leave some time for questions so that if you guys have more specific things, I can answer that and, just make it more informative for you guys.
What was your favorite part about medical school?
Oh, that's a good question. I think when you kind of get to do the clinical rotations, you start to really feel like a doctor. I think that's really cool. Even when you start to interview patients, you kind of start to feel a little bit like important, like you're doing something really cool. Learning and then I think the physical skills part, like when you get your stethoscope and you're like trying to like listening to heart sounds and like learning about all that process, I think I really enjoyed that. But I also enjoyed I think learning learning about the body, but getting to know actually the friends that I made in medical school I still have now. So I think it's just we all have this sort of shared experiences. But I think it's when you actually get to do your clinical rotations, I think is the coolest part.
When you were volunteering, like how many hours would you say you did? Like how much hours would I need to do?
Yeah, it's a good question. So I started off ironically it's not necessarily in Canada, in Ontario. So the province of Ontario is like equivalent to a state. We have to do 40 hours of volunteering in somewhere between grade 9 and grade 12. So that was my starting point. I can't remember how many hours I did, to be honest. I don't know if I kept track specifically. I do know that that's where I started. So I started off so I started volunteering at the language school that I was talking about. It was like every Saturday. And then they were looking for someone to hire. So then I ended up getting a job there. I volunteered at the hospital in different departments. I remember working in the ultrasound department, but I also, they didn't have anyone who to water plants. So I was plant water. I don't know if that's the exact word for it, but I did that. And we would go with a friend, we would interact with like different people throughout the hospital as well too. I did a lot of volunteering through my school, so a lot of like school committees that we had, like different drives and stuff that we had. I don't know if there's an exact number of hours. I don't know in the States. For us, when we were applying, you had to write down like the exact activity you did and how many hours you spend per activity. So I just kept track of everything. Um, but again, a lot of the stuff I started off as volunteering ended up kind of being stuff I kind of enjoyed anyway. So again, if you can find friend or friends to volunteer with you, I'm sure it's a lot harder now with COVID, but at that time it was a lot easier to be able to go and get volunteering opportunities. I don't know if there's specific number of hours though.
How do you maintain a good work-life balance?
Yeah, it's a good question as well too. Um, a little bit of with practice, to be honest. When I first graduated, it's funny, a lot of my classmates started to work like 2 to 4 days a week, and I was working like 5 to 6 days a week, mostly because I just thought, like I've just graduated, I spent all this time getting here, like I feel like why wouldn't I work? And I quickly realized that working 5 to 6 days a week was almost too much, because I spent like all of my free time looking at test results and doing sort of these forms. So I realized that that wasn't a great strategy, so I actually reduced my hours, and I said later on added on something else. But I think it's because I'm a bit of a planner still. So, I try to still make time. I think for me personally, I'm an extroverted person, so it's a little bit difficult during COVID. But for me, spending time with friends and family, just going out, even if it's like for dinner or movies, etc., like those things were really important to me, because that kept me really sane, and it allowed me to sort of come back and actually be more productive which is kind of ironic. Whereas if I stayed at home, I didn't find I was as productive because I just would get distracted by things. Um, but it is possible to have a really good work life balance and to be able to like still make efforts to exercise. So I do live on my own, so I have to, and I have to like, I clean my place, I cook, I, take care of things around the home, I work out. So it is, and work. And so it is possible. It's just, you have to find the right balance, I think, for you. Obviously helpful if you have people who can support you during it, but I think you have to sort of, you have to find it a little bit harder when you're doing your training, because I remember some of my surgical rotations, I had to be at the hospital at like 6 o'clock in the morning. And sometimes I was on call overnight, but sometimes I wouldn't come home till late anyway. So a little bit of a less balance at that point, but I knew it was temporary for me. But so I knew that I could, just make it through those months. But I know for family medicine, I think it's a lot more doable.
What do you think is like the biggest differences between being a doctor in Canada or in the United States?
That's a great question too. So I think I mentioned a little bit about it, and I'm going to obviously try to comment based on the facts that I know. From what I've seen of the doctors in the States and speaking to some of them, um, you know, there you have to try, from what I understand, you have to almost like attract a lot of patients to come to your clinic. And you do, from what I understand, have a lot more worry about making sure that people have insurance and being able to uh afford certain whether it's visits or tests, etc. So like I mentioned, like I don't have sort of that worry, which is nice. I actually have to turn people down because my practice has become quite big, and I just don't think I can take care of patients as well if I take on more new people. Having said that, some of the things that I would say are the benefits, I think, of the States is the fact that, here, because every doctor's kind of gets paid by the government. There, the government sort of put a limit on the number of doctors we have here. And I do think that if we had more doctors here, we would be able to, have some like shorter wait times for certain things. I'll tell you, to see a if I need to refer someone to a psychiatrist here, it can sometimes take almost like a year for me to get someone to be seen. So it's a really long time. So I've had to sort of adjust my practice and I call myself a mini psychiatrist, which is because I have to be able to deal with mental health issues that people have. Otherwise, I mean, it's really, I can't let people suffer for that long. I think in the States, there are a lot more specialists, and being able to refer someone somewhere and get access to care, I think is probably better. But I think the financial stuff for us here, I think, is a little bit easier. If I compare even like, the COVID vaccine, again, I follow a lot of doctors on Instagram. The rollout of the vaccine in Canada has been really slow. I know the States maybe started off slow, and that's what I think was portrayed, but I'll tell you, in comparison to here, you guys had all of your doctors immunized relatively fast. We've been really slow. So I think there's maybe a lot more, I'm sure every place has it, but a lot of bureaucracy, and some of this political stuff makes it sometimes difficult to get as much access to care. Long answer, but I think that's probably the main things.
Would
Yeah.
you rather have, would you rather do morning shifts or night shifts?
Oh, that's a good question too. So I'm not a morning person. So my answer is kind of is interesting. So if I had so I think that morning shifts, though, are probably better in the sense that I think you get through your day. And for me, I think it forces me to get up and actually get through my day. And every time I'm in the clinic, I go in obviously earlier in the day, and I'm always like, wow, I accomplished so much during the day. When I call patients from home, I have a little bit of flexibility, and I know some people like to be called later on in the day. So I sometimes don't start my day till later. It's nice. I get to sleep in a little bit. I have a little bit more flexibility, but I don't know if I accomplish as much later on. I actually never found doing over not over. So when you worked in the emerge, you did like shift work. So sometimes your shift was overnight, sometimes it was during the day. Honestly, I didn't really find working overnight that challenging because I tend to be a night owl. The only thing was then changing back and forth between morning and days and morning and nights. And sometimes that's a bit challenging. I think it's probably also personal preference. I think some people are morning people, and I'm definitely a night owl. But I'll be honest, I think that it's probably still better for me to have a routine in the morning. I think morning people get a lot of stuff accomplished, and by the time the day is over. I don't know. I see that there is okay. Okay. I saw that like someone asked a question about to be an emergency doctor. What should we know about the field? So again, if emergency medicine is kind of what you like, I prior to med school, I don't know if I would do anything really differently. I think you can I don't know if you I know there's you can shadow people, I think the like paramedics and stuff as they go through doing emergency types of situations. But honestly, I think you'll have enough experience in medical school to be able to figure out whether or not emergency is your interest or not. One of my I moved out in when I was in Ottawa in my medical school year just to do my clinical rotations. And one of my roommates at the time, she really wanted to do emergency medicine. And ironically, she went into the emergency to do a shift, and like the first day she fainted. So, and she soon realized that she didn't really think that was eventually what she wanted to do. And she became a family doctor, and I think she's pretty happy. But to be honest, when you go in, you'll have enough experience, and if anything, when you go into to do your rotations, and usually get to pick your schedule, I would just pick having more opportunities to do that and see whether or not it's something that you like. It if yeah, I think experience will teach you. Okay, someone just asked about which opportunities are important for high schoolers. Um, like I said, I would honestly just do anything that you like. Yeah, to be honest, I would include even like if you are in like sports, etc. People who had leadership roles in like even a sports team. Again, I know it's hard during COVID, but those are things that I think do play a role, because it does show the committee that you're well-rounded. I think there's this misconception that everyone needs to do stuff that's just medicine related, and I don't think that if you're just medical, like if your only interest is all in medicine, whether you become a well-rounded enough person to be able to, deal with other things. So I don't know if that I would say as many activities as you think you can manage while still trying to maintain good grades without getting to a point of burdening yourself, right? If your mental health, or you're now becoming stressed with like the number of things you're trying to take on, which just happened. I mean, I know that sometimes I was taking on like committee roles in as some of you are doing here, and sometimes it got overwhelming with trying to do well in school as well too. So I even it was in grade 9, I was about to do my black belt test for Taekwondo, and I had to put that on hold just because I was my first time doing exams. And I didn't know how I was going to do, and it was like the day after my finals, so I put that on hold as well too. So it's okay if you have to that's what I'm saying. I think when I was in high school, I was like, everything has to be exactly perfectly, and everything has to flow exactly. But if you take breaks for some things, and that's fine as well too. Oh, someone's asking what belt. So I got to almost black belt. I was a double black stripe before I quit. So yeah, I mean, I kind of wish I did it more, but I will, for anyone who's looking for a great workout, B, self-defense, and C, actually creates a great ability to gain confidence. I'll tell you, I think Taekwondo is probably the best thing my parents put me in. Yeah. Oh, someone asked about my high school stats. I think I did put it up there, but I got my average in high school was 98%. So I was a pretty big keener. So when I was in grade, so in Ontario, which is the province, like I mentioned, we do testing to see if you're, have ability to do sort of like more advanced schooling. So I got put in, they call it the gifted program. And so in my high school, I specifically chose that high school because it had a gifted program. So we had, I guess it would be like the equivalent of doing like, instead of like regular English, it'd be like AP English or like slightly advanced level. And so the only thing that was good about that was that it prepared me a lot for university, just because it was easier. Yeah, I in high school I was really, like I don't know if I was someone who was naturally smart. I studied a lot. I think I spent a lot of time studying, freaking out, and then realizing afterwards that I was okay. So that was my study process. I don't know if you guys have any other questions or anything you want to ask.
Okay, if no one else has any questions, I put the Google form in the chat so you guys can fill that out for your attendance. But yeah, thank you guys so much for coming. Thank you, Dr. Sarah, for speaking with us. We really enjoyed it.
Of course, not a problem. So like I said, you're more than welcome to, if you guys, I know when I was, well, actually, even in high school and university, was not as keen in asking questions. So sometimes it would hold on to my questions. So if you feel kind of anxious about asking them here, or you think about something later, you can always email me or message me on Insta. Either way is totally fine.
Yeah, so thank you everyone for coming.
Thanks, guys. Have a great night.
Thank you, Dr.
Thank
Sarah.
you.
Nice
Thank you.
Thank you.
Thank you.
Thank you.